In this video, I'm going to talk about free body diagrams and how to apply it in clinical practice. Free body diagrams are very common, but it's more important to understand the principles because you may be thrown a curveball in the exam and asked to draw a free body diagram of the shoulder in 90 degrees of abduction. So it's really more important to understand the principles because then you'll be able to tackle any of the free body diagrams and explain how to calculate the joint reaction force of the joint and also how you could feasibly reduce the joint reaction force. So before you draw a free body diagram, you have to tell the examiner that you are making multiple assumptions. So first of all, bones are rigid levers and joints are frictionless hinges, and there are no antagonistic muscle action. It's going to be a 2D representation of a 3D structure, and the weight is concentrated at the exact center of the body mass. You also make the assumption that muscles only act in tension, and the line of action of the muscle is along the center of its cross-sectional area. And the final assumption is that joint reaction forces are assumed to be compressive only. So I'm going to draw a free body diagram of the hip because it's by far the most common thing that you need to know. And this is it here. I mean, you can draw something very quick and schematic, but I'm just going to draw something like this. So this is a free body diagram of the hip in single leg stance, and you need to, I've only drawn one half, but you need to label it up. So first of all, you need to mark the center of rotation of the femoral head. You need to put on there your abductors, which work in this direction. So this is an anti-clockwise moment. And here at the center of the body, you have your body weight. Okay, and this is normally calculated using 5/6 of your body weight, and that's because you take away a sixth because you're standing on one leg, and the weight of the leg is approximately 1/6 of the body weight. And this is acting in a clockwise direction. So this is a clockwise moment, which is your body weight, and your force of your abductors is your anti-clockwise moment. And a moment is a force which is perpendicular acting around an axis of rotation. So to calculate the moment, it's calculated by the force multiplied by the distance which is perpendicular to the rotation, the axis of rotation. So in this case, the perpendicular distance is from there to there, and this is at right angles. And the perpendicular distance here is from there to there, and this is your right angle there. So assuming that this is a 60 kilo man, making it easy, 5/6 of the body weight would be 50 kilos. And assuming that 1 kilo is 10 newtons, this would be 500 newtons. So we said that this distance was 15 centimeters, and this is 5 centimeters. Applying the rules of equilibrium, you know that your anti-clockwise moments have to equal or cancel out your clockwise moments. So as I said before, your moment is your force multiplied by the perpendicular distance, and this is equal to the force, which is 500 newtons, multiplied by the perpendicular distance, which is 15. So you can quickly work out that your force of abductors is going to be 500 newtons multiplied by 15 divided by 5. They cancel each other out, so it's 3 times 500 newtons, which is equal to 1500 newtons. So your force of abductors, you know, is 1500 newtons. Now that you've worked out your force of your abductors, you can now try to calculate your joint reaction force, which are usually in this direction. And you can do this usually by two methods. Either by trigonometry, by drawing the triangles and working out your joint reaction force that way, but by far the most common is the force closed triangle method, or also known as the closed triangle vector method. So if you have a direction of the force and the magnitude, that is your vector. So your force of abductors has a magnitude of 1500 newtons and this direction. And you know that your body weight has a magnitude of 500 newtons, which in this case would be 3 times less than your force of your abductors, and this vertical down direction. So if you close the triangle, you can work out the direction of your joint reaction force and the magnitude. So this is the closed triangle vector method, and this is by far the most common. So you won't be expected to calculate the exact joint reaction force, but you should know the methods of how to calculate it. So in the exam, you wouldn't be expected to put numbers to the joint reaction force. At most, you just have to explain the principles. So you then may be asked, well, how would you try to achieve a reduction in your joint reaction force, or what would you tell your patient? So remember I said your anti-clockwise moments have to equal your clockwise moments. So anything that would increase your anti-clockwise moments would decrease your joint reaction force. And anything that would increase your clockwise moments would increase your joint reaction force. So if your patient was heavy, that would increase your joint reaction force, which is why you always ask them to lose weight before a hip replacement. If you ask them to hold a stick, you would always ask them to hold it in the opposite hand. And the reason being is because if you hold a stick in the opposite hand, you essentially are creating a ground reaction force, which is a anti-clockwise moment, which would help your force of abductors, which would reduce your joint reaction force. Remember, Newton's third law, every action has an equal and opposite reaction. So if you put a stick down to the ground, you essentially are creating an anti-clockwise moment, helping your abductors and therefore reducing your joint reaction force. Similarly, if you were to hold a heavy suitcase in your opposite hand, this would significantly increase your joint reaction force because you're adding to your clockwise moments. However, if you held a heavy suitcase in the ipsilateral hand, that would help your joint reaction force because you're adding a anti-clockwise moment here, if that makes sense. So then you can apply this to total hip replacements as well, and how would you aim to try to reduce your joint reaction forces in a total hip replacement. So similarly, if you decrease this distance here by medializing your center of rotation when you ream the acetabular component, you are decreasing your joint reaction force. Similarly, if you increase this distance here, i.e. increasing your offset, you would help your anti-clockwise moment and therefore reduce your joint reaction force. Remember, reducing this distance here decreases your clockwise moment and therefore reduces your joint reaction force. So similarly, if you had a valgus neck, you would have a reduction in this distance here, and therefore you would have an increased joint reaction force because of a reduction in your force of the abductors. However, if you had a varus neck angle, then this distance would increase, helping your joint reaction force. I've covered a lot there, and I hope that makes sense, but at least if you have this principle, you would probably be able to draw a free body diagram in any part of the body. But to understand other free body diagrams, you may be asked about different classes of lever. Now, the hip is a class 1 lever, and there are 3 classes of lever. So drawing the hip again, you have a fulcrum in the middle, and you have the force on one side and load on the other side. So this is a first class lever. So this will be your force of your abductors. The fulcrum would be your center of rotation of the femoral head, and your load is your body weight. So this is an example of a first class lever. An example of a second class lever is where you have the fulcrum on one edge, and you have the load and the force. So you have the force right at the end, and you have the load in between the force and the fulcrum. So this would be an example of someone standing on tiptoes. So to give you an idea, if this is your leg there, this is your center of rotation. Your Achilles tendon is working here, and your weight, or your load in this case, is here, and your force from your Achilles is that way. So fulcrum, load, force of your Achilles. So this is your second class lever. Your third class lever is similarly when you have a fulcrum at one end. However, your load is right at the end and your force is in between. So this would be an example of the elbow. So if you have a lateral of the elbow, so that's your ulnar-humeral joint there. That's your olecranon, your ulnar. You have your brachialis coming here, pulling this way. And if you're, and then you have the weight of the arm, or the weight of your arm holding an object in this direction here. So here you have the load, here you have the force, and the fulcrum is the center of rotation here. So if you were asked to draw, for example, a free body diagram of the shoulder in 90 degrees of abduction, what I tend to do is draw the glenoid, keep it simple. You have the humeral head, center of rotation, and then you have your arm, and then you have your elbow joint here, and then you have your forearm there. So to label this up, you have your pull of your deltoid here, remember. So that's your force of your deltoid pulling that way. So I'll put this as FD, force of deltoid. And here at the center of your humerus, you would have the weight of your humerus. Okay, and here at the center of your forearm, you'd have the weight of your forearm. So we can call this force of your humerus, and this is the force of the forearm. So then you have to work out the perpendicular distance to the pull of your force, which will give you, which will help you work out your moment. So this is the perpendicular distance here. That's a right angle there. And your perpendicular distance, so if I draw a vertical dropped line here, your perpendicular distance will be there to there. And from here, it'll be that distance there. So if I call this distance 1, distance 2, and distance 3. And so your joint reaction force will probably be somewhere in this direction. So to calculate all of this, applying your assumptions, which I mentioned before, all the same assumptions apply, and applying your rules of equilibrium, all your clockwise moments have to cancel out your anti-clockwise moments. So if we take our clockwise moments, which would be your force of your deltoid multiplied by distance 1, that has to equal all of your anti-clockwise moments, which would be your force of your humerus multiplied by D2 plus your force of your forearm multiplied by D3. So with that in mind, you can work out, if you have these distances and you know the weight of your forearm and your humerus respectively, you can work out your force of your deltoid by dividing all of this by d1. So once you've worked out the force of your deltoid, you then have a vector. So you have a magnitude and a direction. So you can work out, using the closed triangle vector method, your joint reaction force, which is simply adding all your anti-clockwise moments together. So this can be your force of your forearm, force of your humerus, plus your force of your deltoid, which is here, and that leaves your joint reaction force here. Sorry, this is your force of your deltoid. So again, the examiners aren't expecting you to put in the numbers to work out exactly what the joint reaction force is, but you are expected to know the principles of how to calculate the joint reaction force. And you'll very reasonably probably be asked about tiptoes, joint reaction force in the vertebrae, or even at the elbow at 90 degrees holding an object. So the other thing that you may be asked is why, or draw the joint reaction force of the patella of someone going downstairs. Now, this is a question which is really asked to test your knowledge of application of the free body diagrams and what they truly mean. Here, you're not, when you're asked about someone going downstairs, what they're truly asking is the patellofemoral joint reaction force in deep flexion, because your leading leg, when you're going downstairs, goes into deep flexion. And essentially, when you go into deep flexion, so this is your patellofemoral joint. This is your patella. This is the pull of your quadriceps. This is the pull of your patellar tendon, and this is your femur with the center of rotation, and your tibia here. So you don't actually need to calculate what the distances are of the free body diagram here, because you know that your joint reaction force acts in this way, and your joint reaction force will be the sum of the vector of pull of your force of your quadriceps and the vector of pull of your patellar tendon. So if I explain, so if this is your two vectors here, when you go into deep flexion, your vector of your quadriceps and your patellar tendon go in a more horizontal fashion, not completely horizontal, but more horizontal. So you can imagine if you are standing up straight, your vectors of force between your patella and your quadriceps would be roughly in this direction. Okay. However, if in deep flexion, your vectors will be more in this direction. So if you apply the closed triangle vector method for someone who's standing up more or less straight, and you join the two vectors, so first of all, your first vector is this way, and your other vector is this way, your joint reaction force would just be this vector here. So if you compare it to someone so this is someone standing, and this is someone going downstairs or in deep flexion. So if you join the two vectors here, which are quite obviously slightly more horizontal, your joint reaction force is going to be much larger. So remember, a vector has a magnitude and a direction, and you can clearly see that the magnitude of this vector in deep flexion is much larger than this magnitude while they are standing. And that's the principles. When you go into deep flexion, your joint reaction force in your patellofemoral joint is going to be much larger than someone who is standing. The last thing I want to mention is the free body diagram to calculate the joint reaction force in the tibio-talar joint. So wherever you want to calculate the joint reaction force, this is where you put your fulcrum. So to not confuse matters, when I talked about classes of lever, I mentioned that standing on tiptoes was a second class lever, where your fulcrum was here, and you have your force at one end and your load in between your force and your fulcrum. Now that is true if you were wanting to calculate the joint reaction force at the first metatarsal head. However, if you want to calculate the joint reaction force at the tibio-talar joint, this becomes a first class lever, because now your force of your Achilles is on one side, and your load represented by your ground reaction force is on the other side of your fulcrum. So your classes of lever and your free body diagrams, it depends on what application you're actually using it in, so it's not to be confused. I hope that makes sense.